Dad, thank you for agreeing to help with our project.
I'm glad to help.
Awesome. Well, let's get started with the interview. So first off, how long have you had acid reflux?
I've probably had acid reflux for about 25 to 30 years.
And how exactly did you discover that you had the disease?
It's pretty easy when you know you have it. It's a constant, at nighttime usually, heartburn. The actual reflux itself is when your stomach kind of pushes abdominal acids up into your esophagus, and that's the reflux part of it.
Okay. Now, you've talked some about the symptoms that you have. Do you know if there's any triggers, like specifically for you, that bring on these symptoms?
Yeah, it's a real good question. The triggers for me, and it seems to be pretty universal, is fatty foods, spicy, acidy foods like tomatoey. But one of the biggest triggers I found is eating before bed. If I can go 2 to 3 hours before bedtime or before I go to sleep after my last meal, I have no symptoms.
Okay, wow. All right. Now, obviously you've had the disease for a long time, so I'm sure you've taken many different medications for the reflux.
Sure.
What would some of those medications be?
Well, at first, when I first had it, I was using over-the-counter antacids. This was way before they really started coming up with the new, what they call proton pump inhibitors. After I went to the doctor and was diagnosed, I started on Prilosec, and then the last few years I've been on Nexium.
All right. And which of the medications do you feel was most effective? The Nexium, the Prilosec, or the antacids?
Well, the antacids was a temporary relief. They were treating a symptom rather than the root cause. The Prilosec was really just kind of phased out through insurance when it became an over-the-counter drug, and Nexium is kind of the next generation of proton pump inhibitor drugs.
Okay, awesome. Now, as we all know, medical problems usually aren't very simple to fix. Most of the time, it's not given a medication and it's gone. So have you ever had any severe problems from the disease, either with the acid reflux itself or one of the medications you've taken from it?
Yeah, as a matter of fact I have, and just here recently I found that PPI medications, Nexiums, Prilosecs, are not for long-term use. Some of the things that I've discovered is I've the last few years I've been suffering from chronic anemia, and there's some research out there now that shows that the PPI type drugs prohibit your absorption of iron and vitamin D, which kind of leads into an anemia conditions.
Obviously a big problem if you already have existing anemia problems.
Big.
Now, we've talked about the medication, we've talked about problems with it, but as I talked about earlier, medication usually isn't enough. So what types of lifestyle changes have you had to make because of acid reflux?
Yeah, the biggie is changing my diet of what I eat, but I found really more importantly is when I eat and how much. I could eat a big meal of very bland food and go right to bed and have acid reflux, where I could eat a spicier meal as long as I wait and don't eat as much, and I'd have no symptoms.
And if you take your medication regularly, this obviously helps with those lifestyle things as well, correct?
Correct. That is true. However, one of the things that I found is on this medication, I feel that my doctor gave it to me, did not follow up. I've been on it for several years, and I found that there are problems with being on it long term.
Wow, very interesting. Thank you for sharing that with us. All right, well, it's almost time for the end of our interview, but is there anything that you think the students in my anatomy class would need to know about acid reflux?
Yeah, acid reflux is something that really affects millions and millions of people. I think it's more of our lifestyle and diet than anything else. With that being said, I think most of those can be treated without medication or with short-term use of medication, which is probably most responsible.
Awesome. Well, thank you for sharing that, and thank you for participating in this interview.
Yeah, it's a pleasure. Thank you.
Thank you. Over and out.
And out. Very good, Leah.
Thank you. Participating in this interview.
Yeah, it's a pleasure. Thank you.